morning. I am Dr. Andrews, Professor of Medicine and Consultant Neurologist. Today I am going to discuss with you about obesity, competency in internal medicine 14. What is obesity? Obesity is excessive or abnormal deposition of fat. It is either excessive or abnormal deposition of fat or adipose tissue in body and that impair health. This is can be considered as a definition for obesity. Today we will discuss the epidemiology of obesity and the pathophysiology of obesity. Treatment aspects will be discussed in another session. This is CBME Internal Medicine Competency 14. Obesity has become an epidemic. It has grown as in epidemic proportions. More than 13% of adults are having obesity. Economic burden of obesity is very high. It is because of its health impact and association with the development of diabetes mellitus, dyslipidemia, coronary disease, stroke, fatty liver disease, gallstones, and various malignancies. So it is important to remember that obesity produces various complications, and that is why it is very important to learn about the obesity. Now we look into what may be the pathology or underlying etiology for obesity. Basically, you can say obesity is an imbalance between energy intake versus use of, and when there is an imbalance occurs, the energy expenditure, excessive weight gain occurs. So this is the basic concept regarding. It has got various etiologies, multifactorial. One, genetic way, and that is why it can run in families. Various genes are there, they are heritable. Second is cultural factors. In children, the fatty children are considered to be more healthy and attractive, and so cultural and social factors are important. Numerous genes have been identified. Other causes include decreased physical activity, that is, energy expenditure is less. Sedentary lifestyle is definitely associated. Insomnia, various endocrine conditions like Cushing syndrome, hypothyroidism. Various drugs can produce. Example, steroids, antidepressants, all can lead on to excessive intake of carbohydrate containing beverages, ice creams. So the common syndrome associated with obesity, one is what the Prader-Willi syndrome, about which we will study later. Then the Bardet-Biedl syndrome. Bardet-Biedl syndrome. So there are certain genetic conditions or syndromes which are associated with obesity. Deficiency of leptin is another example. So we will not be discussing these things in detail now. Now we go into the epidemiology. I already mentioned that more than 13% of adults are having obesity. Now we go to the pathophysiology of obesity. As mentioned, obesity is associated with cardiovascular disease, dyslipidemia, insulin resistance, causing diabetes, stroke, gallstones, fatty liver, obesity, hypoventilation syndrome, sleep apnea, and cancers. So the very important to remember, you can produce diabetes mellitus, dyslipidemia, cardiovascular disease, stroke, fatty liver disease, very important, and leading on to cirrhosis, gallstones, various malignancies. So these are few of the problems that are associated with. In addition, you can get a hypoventilation syndrome, sleep apnea. I have mentioned that many genes are associated. One gene is the FTO gene. Going to the underlying mechanism, the tissues produces, especially the adipose tissue, produces a hormone called leptin. So leptin is an adipocyte hormone. This will act on hypothalamus and produces satiety. So abnormalities of leptin can lead on to increased weight gain. And whenever there is excess fat tissue, this will get deposited in the liver. It can get deposited in the heart and produce dysfunction. Another hormone that is produced by fatty tissue is the adiponectin. Adiponectin activates inflammatory pathways, and this will lead on to systemic inflammation and can lead on to various disorders. The renin-angiotensin mechanism can be affected, causing salt and water retention and elevated blood pressure. So, how will you look for obesity? Classically, we go by the body mass index, BMI for Asian population, and others are different. So normal in an Asian should be more than 17.5 to 22.9 or 23 can take. 23 to 28 is overweight. More than 28 is obese. Whereas in Western population we take it as 30. So normal BMI is 17.5 to 23 for Asians. In addition to BMI, you may look for triceps skin fold thickness. Suprascapular fat also can be looked for. In addition, you should look for the waist hip ratio. waist hip ratio more than 1 in males and more than 0.8 in female is abnormal. One more concept you should keep in mind, one is the metabolically obese normal weight. So these are people, their weight is normal, but they have got all the complications of obesity. Another is the metabolically healthy obese. Even a BMI of more than 30 may not be associated with any abnormalities. This is common in, for example, in sumo, in Japanese sumo people. So that is another factor that you should remember. The distribution of fat is more important. That is why we say the abdominal obesity or the visceral obesity is dangerous compared to the deposition of fat that is seen in other parts of the body. So a patient with obesity had to take a good history. So what are things that you should ask in the history? You will be looking for childhood weight. As a child. Second is nutritional history. Sleep pattern. Physical activity. Family history. Medications. And the complications due to, like cardiovascular, nervous system and liver. Social history should be very important. As example, or the importance of alcohol, free calories, smoking, which may increase the risk of other comorbidities. During physical examination, think about endocrine conditions or the secondary causes of obesity, Cushing's syndrome, hypothyroidism. Look for acne, hirsutism in females, acanthosis nigricans, which may indicate insulin resistance. Striae, especially red striae, that means striae suggestive of Cushing's syndrome. The buffalo hump, the fat pad or fat distribution in other areas, gynecomastia, hepatosplenomegaly, hernias. A proper examination should be done. During the evaluation, in addition, we have already mentioned the BMI, waist hip ratio, tricep skin fold thickness. It should be made a part of examination. Further evaluation depends upon, you may go for MRI, CT, DEXA, etc. if there are complications. The laboratory tests include a complete blood count, metabolic panel, go for a liver function test, renal function test, and thyroid stimulator TSH. Minimum thing to be tested. We check the vitamin D levels, CRP, looking for inflammation, ECG, and other tests depends upon the comorbid conditions present. So always think about the genetic causes, think about the endocrine causes, think about the lifestyle factors related to obesity. So today we have discussed the epidemiology, the major causes, pathophysiology, and some of the complications of obesity. In the following session, we will be discussing the management of obesity. Thank you.